Basically, just a very brief introduction about myself. My name is Abdurrahman Al-Hawari. I'm a dentist from Egypt. I'm currently the digital and clinical instructor for 80th Medical. I'll be happily introducing to you today the Finscan F350. It's the brand new CBCT produced by 80th Medical. This is mainly, like I told you, a product overview through this presentation. Then we will go to the software. We will have a software walkthrough. So basically, the first thing about the Finscan is that it is a 3-in-1 integrated imaging system. So as a dentist, when I acquire the Finscan, I'll have all the imaging solutions that I would need as a dental practitioner. First of all, the CT imaging, followed by the panoramic imaging and the lateral cephalometric imaging. During the panoramic imaging, we have two scan modes, and the full arch scanning time is of 14 seconds, and this is the first scanning mode, and the TMJ scanning time is of 6 seconds. While in the cephalometric imaging, we have three scanning modes: the anterior, the lateral, and the carpal bone scan. The anterior and the lateral have 8 seconds, and the carpal bone scan takes the scan in about 6 seconds. So mainly, I'll be talking now about the points of strength and the selling points of the device. First of all is the optimal FOV. It has an optimal FOV and multiple FOVs. And this optimal FOV, which is the 16:10, it is great for dental practitioners and especially dental surgery practitioners who would like always to record the TMJ, the sinuses, or the zygomatic bone for the planning of dental implants in the zygomatic area, for example. So always for full mouth diagnosis, it's better to have a CT with this FOV. It's a very high FOV in regard to dental CTs. So medical CTs, this is a normal FOV for them, but there are medical CTs, they have huge exposure. The dose is so much more than the normal, and it's not directed for dental treatments. It's mainly directed and used for maxillofacial and general surgery treatments. So when it comes to dental, 16:10 is ideal, and it's actually a very high FOV. Also, we could change the FOV into 8:8, which will record the lower and posterior, upper and lower molars and premolars. And as you guys know, it's just basically, it is as if it's a photo. So when the photo is so big, then the pixel size is also big, then the quality will be limited. But when you decrease the size of the photo, the pixel size or the voxel size here decreases, then the quality of the photo gets even better. But what is surprising with using the Finscan, and I will show you, is at the 16:10, actually the quality of the very fine details is really high, and the very fine details are really clear even with root canal diagnosis. The last FOV is the 4:4, in which it will record the anterior teeth and the anterior area of the mouth. The thing is this is the optimal FOV of 16:10. As you guys see, the zygoma is completely clear and the TMJ is completely clear. Of course, it differs from a patient to another because not all patients have the same vertical and horizontal dimensions and height of their face. So we do have multiple chin rests that are available and accompany the device. Whenever we are taking a scan solely for TMJ and zygomatic bone diagnosis, we use the chin rest that is called TMJ chin rest, which elevates the patient's chin and starts the scan from the middle of the lower arch in order to record much more area of the face and much more area of the TMJ. But with standard patients, the standard chin rest would be more than enough to record starting from the chin up to the TMJ using the standard FOV, which is 16 by 10. The thing is, 16 by 10 FOV in Finscan is actually, we can obtain this FOV with a single imaging system. There's no stitching. So basically, other devices, when the FOV is too high, they take multiple images and they keep on stitching them together. The device takes multiple images and stitches them together to create the final image. While with our device, it's a single imaging system. It takes one image and one shot, and it calibrates this shot in order to obtain this image. So there are multiple drawbacks with the stitching technology, that the image quality at the areas that are stitched, it's not that high. And also, it takes a huge amount of those in order to obtain the image. So having the ability to take such an image without stitching gives us two advantages: that the image quality is higher at the stitching points because there are no stitching points, there are no motion artifacts, and also less dose exposure for the patient. Concerning the CT, which is the sole purpose of buying the device for any practitioner, and it's the most important imaging system that is available within the 3 imaging systems in the device. We have multiple scanning modes in the CT. First of all, we have the general mode, which has a scanning time of 18 seconds. And we have a fast mode in which it takes the scanning time in 9 seconds. Of course, the fast mode is mainly used for patients who cannot stay still for 18 seconds. For example, a pedodontic patient, a child, or for example, a patient who is medically compromised and he has problems of staying still. So we use with these kinds of patients the fast mode. And still, the advanced algorithm, the algorithm that is available within the CT, gives us really high quality images at the 9 seconds. But of course, at the general mode, the scanning quality would be better. The other mode is the pulse mode, in which the dose is 40% of the normal dose exposure. So mainly also with medically compromised patients that we do not want to expose to very high radiations. So we use the pulse mode. Or patients who are already undergone multiple CTs in the past 3 to 4 months. So we want also to decrease the exposure of the radiation for them. So we lower the dose using the pulse mode.
Doctor, for the pulse mode, can you use it all the time? Or what's the advantage?
The disadvantage is the image quality. Of course, if you're using 40% of the normal dose exposure, so of course it will affect the image quality.
Okay, understand.
So so that's the thing. You could use it if you. What I say to each client is, you have multiple options within the device. Just use them, and it's an optical property. So you could check with your eyes. If this quality is good enough for you, then you're doing your patient a favor.
Okay, I got it.
So yeah, you could try it at first. If it's good enough for you, then you're doing the patient a favor, and you're doing everyone who may get exposed to the radiation a favor by reducing the radiation up to 40%.
Okay. Okay, I understand.
Okay. So regarding our software, regarding the AI or the artificial intelligence, so just let's be clear that you could have the same device with the same hardware, but with a different software, and you will get and obtain huge and different image qualities, hugely different image qualities, because it's not just about the hardware. The software algorithm plays a very, very important role. And the software algorithm of our Finscan is completely designed by a teeth R&D team. So it's also the AI that is available within the device is completely designed and produced by our teeth R&D team. The AI has two main functions. The first function is the denoise function, in which it enhances the image quality and decreases the noise that is obtained while taking the scan. So this is an example of an image that was taken without the AI denoise activation function. And this is an image with our AI denoise function. As you guys can see, there's a huge difference between the two images. This image is so noisy, this one is more smooth. So the two images are taken with the same device, but the difference is the AI algorithm that is available within the software. The second AI function is the metal artifact reduction, in which whenever a patient has multiple metal objects inside his mouth, for example, multiple implants, multiple crowns, multiple metal restorations. So usually these things cause artifacts within the scan or within the image. So the algorithm and the AI, which is available in the software, enhances the image quality and decreases the metal artifact reduction. So regarding the overall design of the product, so the product might seem large for a CT device, but to be clear, for a 3-in-1 device, it's the most compact 3-in-1 device that is available in the market. The maximum footprint is 2.35 meters squared. So you need a room that is of a minimum 2.5 meters squared. And whenever you do have a client who is interested, you can share with us the blueprint of his clinic, and a teeth engineer can actually design and put on the blueprint, can put the most suitable position of the device within the blueprint and share it with you. So yes, might seem a little bit large, but it's the most compact in the whole market regarding when it comes to a 3-in-1 system. This is the blueprint, if you guys want to take a photo. So when it comes to the height, it can accept a patient height ranging from 1.2 meters to 1.9 meters. So it actually can move up and down up to 700 millimeters. And the thing about the patient, if the patient is too tall, even taller than 1.9, then you could just take the scan while standing, but just while sitting, sorry. But you have to ensure the patient that he is sitting still and he's sitting in the right position. And I will let you guys know the right positioning of the patient while going through the software walkthrough. So this is actually a part that is very important for all leaders, is that the device is very easily installed. It just comes in 3 pieces. The panorama and the CT arm, the base, and the lateral cephalometric arm. And you just join these 3 pieces together. So actually the hardware installation, it takes about less than an hour, the hardware installation. The wiring system takes about an hour also. So you could finish the whole installation of the wires and the whole installation of the hardware in about 1 hour and 45 minutes by average. And then you could go on and start with the calibration. It's a huge advantage because, as you guys know, there are multiple brands in the market in which it's very tiring to actually do the installation. It comes in too many boxes. So it's more of a very huge puzzle that if you mess up one part of the puzzle, it would all go wrong. So all of this hassle is eliminated with the Finscan. It's just 3 parts that you could easily install.
Right.
Yeah, when it comes to mounting, we have the option if you'd like to mount it to the floor or if you'd like to mount it to the wall, the option is available. But here in Egypt, we didn't have to mount it at any of our clients, for example, because mainly the device is too heavy and it's very stable because the base is too heavy also. So you don't need to mount it unless you are in areas that are susceptible to earthquakes. Then we would recommend to mount it either to the floor or the wall, or if you would like to do it both. So, like I told you, it's the most compact, a 3-in-1 device that is available in the market. And this is actually not by chance. This has actually had a purpose to have a short geometrical structural design, because the short geometrical structural design gives us higher image quality on a lower dose exposure. So without getting into too much details, but in general, the radiation dose is always inversely proportional to the square of the distance. So whenever we decrease the distance from the X-ray tube to the detectors and to the HD detectors and the patient, then we are increasing the image quality on a lower dose exposure. So that was the idea of having a compact design and a short geometrical structural design. In general, this is a general rule that the panoramic dose is about 1 to 10 of the standard and general CBCT dose, and the cephalometric dose is about 1 to 100 of the CBCT dose.
Doctor, will you be able to choose whether you want to just take a panoramic image, or
Yes,
if it
of
all just
course, of course. Yes, of course. I'll show you how. I'll show you
okay.
everything.
Okay.
Yeah, I have just like 4 minutes left for the presentation. It's a full overview just to know everything about the device. Then we will go to the software if you guys have time. If you guys are in a rush, I could just go to the software.
I know we have time. No worries.
Okay, great. So regarding the product specs and the hardware specifications, these are the main points and the most important points. First of all, the detectors. The detectors are HD detectors. They are Korean brand detectors. And the X-ray tube is from a very, very reliable Japanese brand. And it is a focal spot of 0.5 millimeter. And let me be clear, the design of the device and the production is completely from ETEETH, except for some imported parts, like the X-ray tube and like the detectors. So mainly, these are most of the hardware specs and the numbers that you guys have to be familiar with. So you could take a photo of this slide. So now I have just a quick image presentation to show you some images that are taken. This is an axial cut for a patient, but the patient had a really good set of teeth and good overall oral health. This is the same patient with a sagittal cut. This is another case with worse conditions that are not really good. This is the sagittal cut. As you guys can see, it's really clear on this cut. I can detect the nerve. From here, I can easily see the roots of this upper 8, which has slight curvature here. So whether it's for I'm obtaining diagnostic information for surgical or for root canal procedures, as you guys can see, it's actually very clear. This is another case of an implant, single implant placed. Two implants with two connected crowns, and actually having two connected crowns can cause too many artifacts. So of course we have to activate the metal artifact reduction option. And as you guys see, the image is clear. We always like to test CT images on patients who have multiple crowns that are connected or multiple implants that are with connected crowns. This is another case with connected PFM crowns, and actually it's worse than implants when it comes to the CT images. Is a case that has root canal treatment in the lower six. As you guys see in this image reconstruction, the animation here, it's very clear. The canals, it's very clear that this is very poor obturation. Just a single cone. I can detect it from here. It's just a single cone, and even the Gatuperca is not even cut in a good way. Here's our 3 implants placed. Like I told you, the image quality is very high within 3 implants placed because it's not that hard to the software to produce a very good image quality with implants. It's even harder when the crowns are connected. So here you could see from this axial cut there are no artifacts at all at the implant's position. This is the 2D panoramic image quality. Another case. Here's a case with a single implant placed, no artifacts at all. This is the cephalometric image. Okay, so regarding the Finscan software, quickly, I'll just give you an overview from here quickly, then we will go to the software itself. So the Finscan software in general, it's divided into 2 parts. The first part is called the Finscan, and the second part is called the Fin3D viewer. So the first part, which is the Finscan, it's responsible for the management of the whole patient data and the images, and you have complete control over the device through it. So the device actually in the hardware, it has about 3 or 4 buttons that are responsible just for the device to move upwards and move downwards and just activate the laser and prepare the device. That's all. Other than that, the complete control over the device and to start scanning and to change the parameters is the whole thing. You could do it from the software. Also, from the first software, you have a 2D image viewer and the patient report. The 2D image viewer and the patient report, they are so similar to the Nanopex. If you guys are users for Nanopex or familiar with Nanopex, you will find that it's very similar. Then the other part, of course, and the most important one is the Fin3D viewer, which is the viewer for the CT, in which we have multiple viewing modes, the multiplanar reconstruction, the pano, the implant, and the verification, and the TMJ mode. We will speak briefly about each one. So this is the first one, the first software. This is the Finscan. As you guys can see, you could manage the whole patient data and the whole images, and it's also similar to the Nanopex. And from the acquisition area, you have complete device control. So you could actually choose the scanning mode, whether it's general, fast, scout is the same as pulse, just we used a different name. Choose the size of the most appropriate size of the patient, the recommended FOV, and from here you have the AI parts. So this is the AI denoise that I talked about, and you should always keep it on. And this is the metal artifact reduction AI function. I don't always keep it on. I always like to keep it on where depending on the case. So whether the patient has multiple implants, multiple crowns, then I go on and activate the metal artifact reduction. And this is the 2D viewer. that is available within the device. And last but not least, in this software is the standard patient report, the same one as in Nanopex. This is the Fin 3D viewer application. Like I told you, we have the multi-planar reconstruction viewing mode, the pano, the implant, the verification, and the TMJ. The multi-planar reconstruction mode is mainly the basic viewing mode to any CT in which you have axial, coronal, and sagittal cuts, and a 3D animation of the patient's. The pano mode is the mode in which the software automatically creates a panoramic image from the CT image. The implant mode is the mode used for the virtual implant placement. We do have a complete implant library that is available within our software. And the verification mode is a newly added mode in which it cuts the region of interest in which we placed our virtual implant into buccolingual and mesodistal sections in order to actually check the implant placement and accurately virtually place our implant. And the last mode is for the TMJ diagnosis and for the TMJ viewing, which is the TMJ viewer. So now the last part of the presentation is about the FinCloud. So now the FinCloud is actually working. The FinCloud, you have up to 500 gigabytes. You could upload all your cases on the FinCloud, and you could also add some members to your account in order for if you have multiple members in your clinic or in your institutions who you want to share with them the photos. So you could just upload it to the cloud, and they would just enter the cloud and view the photos. This is the 2D view that is available through the cloud. And we do have an AI analysis, a complete AI analysis for the image. So similar to the one in Nanopex, but the one in Nanopex was just small to a periapical image. It was actually revolutionary when we produced the Nano AI with Nanopex. And this one also would be revolutionary in the market because this is an AI analysis over the whole panoramic image. So you could actually do a whole treatment plan for the patient through the AI. I know it's not actually very helpful for doctors. No, it's very helpful. It's not regarding the diagnostic information. It's very helpful regarding the patient communication because the patient always accepts a printed document or a PDF document that is generated with an AI, and he gains more trust with the practitioner that he is being treated by through such application and such reports. So it's a breakthrough in the patient communication era where you could just, by one click, have a complete AI analysis for the patient and share it with him through a PDF.
Doctor,
This is also that. Yeah, go ahead.
Yeah, Doctor, the 500 gigabytes, is it free?
Yes, completely for free.
Oh, okay. No, okay.
No subscription fees.
No subscription. Doesn't expire as
No.
well. Okay.
No, we, as far as I know now, we don't have any expiry date, neither any subscription fees.
Okay.
And I believe this is the plan. I believe this is the long-term plan. It's not a short-term thing.
Okay. And you're able to delete files, add,
Yes,
edit.
of course.
Okay.
Yes, of course. It's like any cloud that you have ever used. If you have used the Helios cloud, then it's also similar. You could delete files, and also you could share files. This is the thing that I was going to talk about now, that always sharing CT files, it's very large. The DICOM files, they are huge. So whenever I want to share it with a colleague, or I'm actually a digital or a radiography center, I don't know if in the Philippines you have radiography centers, X-ray radiography centers, who just the patient goes there to take the X-ray or the CT scan, and then the center would send the scan to the doctor who's responsible for the case.
Yeah, yes,
So
there are.
yeah, so it was sharing the file is always a hassle, either through a flash drive, either through a Google Drive, either through just a CD. So it was always a hassle. Now we will eliminate all of this through using the Finscan, because you will just upload the case to the cloud and then share a link. As you guys see here, I'm opening this up through a window through my browser. You just share a link and click this link with the required case and send this link through WhatsApp for the recipient. And just by opening the link, the whole software opens through the browser with the chosen case. So it actually made sharing cases so much easier.
Amazing.
Yeah, this is a huge breakthrough, especially for radiologic centers.
Yes. So the viewer does not need a separate software. They can just open and view through the browser.
Yes, you could just open it and yes. Of course, you could also, if you would like to share the whole viewer software, of course, you could do this also. But you don't have to. The thing is, this is much more easier. You don't have to.
Okay. Will annotations and notes also transfer?
Whatever you have put inside this CT scan, whether an implant and a virtual implant placement, whether notes that you placed upon the images, whether a neural canal that you have traced, once you have uploaded it with all these changes and all these adjustments, and you share this file, the recipient will be able to open it with all the adjustments that you have done.
Okay, that's great. And how big would you say is one file, doctor?
So basically, it's dependable. So the basic DICOM file, I can show you multiple files now. You could check the size, but mainly when we share it through the cloud, it's less than half a gigabyte.
Oh,
Less, like, yeah, it's
okay.
not too large.
Yeah.
That's mean, but of course it's dependable. So not each patient has the same the same amount of data.
Right. Okay.
So, like I told you, also from the cloud viewer, you could actually send it to someone for him to do the virtual implant placement and the whole implant planning for you through just the browser. So quickly, the main key points of the Finscan F350. First of all, it's a 3-in-1 imaging system. 3-in-1 imaging system gave me all the options and imaging solutions that I would need as a dentist within one device. It has a very compact design regarding a 3-in-1 system and short geometrical designs, which allows higher image quality on a lower dose exposure. The X-ray tubes, they are imported from Japan, and we have 2 large-sized HD detectors. The maximum FOV is the optimal FOV without stitching, and it's 16:10. We have a very well-developed AI system in which does image denoise and metal artifact reduction. And we have to be clear that the software is 100% self-developed, the standard software and the 3D software, which gives you and ensures you lifetime free of charge software updates. So that's all regarding to our presentation and the whole product overview. If you guys would like to reach me with any questions, this is my channels. So, and now I will go to the software just to have a walkthrough through the software itself.
Okay, Doc. Also, a lot of our customers, sometimes they ask about the TMJ. I think this is this is a popular request here.
So whenever he's asking about the TMJ, so we have to clarify that we have a separate TMJ viewing mode. So it's not just most other softwares, they don't have a separate TMJ mode for viewing. You just view it with the whole scan within the MPR mode, but we have a separate mode for viewing. And also we have a chin rest that is the sole purpose of using the chin rest is for TMJ recording. So, not all patients have the same vertical dimensions and horizontal dimensions of their face. So with the standard patient, the 16:10 with the standard chin rest would be more than enough to record the TMJ. But some patients have a tall face. So we will have to use another chin rest, the TMJ chin rest. It elevates the chin of the patient. So we do not record the whole lower arch, but instead we record the whole upper area of the face.
Okay.
So this is the point for the TMJ diagnosis.
Okay, got it.
So basically, but basically in general, 16:10 would be more than enough to do the whole mouth diagnosis, TMJ diagnosis, lower arch and upper arch diagnosis also. But if we're doing the treatment and we're doing the scan solely for TMJ diagnosis only, then I would recommend using the TMJ chin rest. But if we are doing an overall diagnosis for the patient, then go by the 16:10. It would be more than enough to record all the anatomical structures that you would need to view.
Got it.
So this is our software. It's very easy. This is the first part, which is called the Finscan. You could manage all your patient files from here. Okay, so this is my patient list. I could add a new patient from here. I could edit an existing one and delete an old patient. Here I could search about any case that I have through this search bar. And on this menu, I could choose the imaging mode that I would like to use, whether it's a CT mode, pano, or a cephalometric. So before I start taking the dose, or before I start taking the image and filling the patient info, I could actually change. So I can take a panoramic image alone without taking the CT, and I can take a cephalometric imaging alone without taking either the panorama or the CT. And from the right side here, we can switch between the different modes that are available within the software. First of all, this is the patient mode in which I can manage all the patient files and add new patients. The acquisition mode is where I have complete control over the device. So I choose the scanning mode was CT. So here we'll have the modes for CT. Through this acquisition mode, we could choose the scanning mode, normal, fast, or scout, and the patient size. I always recommend whenever the patient is male to an adult male to put the patient size on the maximum size. A female, we could use the one in the middle, and a pedodontic patient, we could use the smallest one. So the FOV, I could also control it, 16:10, 8:8, and 4:4. Like I told you, 16:10 is the optimal, but with 16:10, it is a huge image. So the voxel size, the least thing within 16:10 is 200 voxel size. If we decrease the FOV to 8:8, I can decrease the voxel size up to 100. Also with 4:4 up to 100. With our next software update, we will be able to also decrease the voxel size to 0.75. But when you see the image quality now, you'd be surprised that all these images are taken with the voxel size 200, and such image quality and such diagnostic information can be obtained from the image. So this is the AI part, the denoise and the metal artifact reduction. I always like to keep the denoise function on, the metal artifact reduction based on the case. So from this part, we could activate the laser light of the device in order to align the patient and place him in the perfect position, and then give the order for the device to start preparing and start our scan. So if we're taking a panoramic image, so the acquisition menu will be a little bit different, in which you could choose if you're just taking a TMJ scan using the TMJ chin rest, a TMJ panoramic scan using the TMJ chin rest. So always make sure for TMJ diagnosis and taking a panorama, choose this mode. And when you choose this mode, you have to place the TMJ chin rest for the patient. And regarding a cephalometric, you choose whether you are doing a lateral cephalometric, a frontal, or a carpal cephalometric image. So regarding the voltage and the milliampere, whenever it's an adult, I always like to keep it on 90 and 10. Whenever it's a child, it's automatically changed into 80 and 8. This is my recommended parameters. You could, by usage, you could actually try different parameters and check their image quality. And the one that suits you the best, you could go with. But my recommended parameters is the one that comes with the device automatically.
So would it be safe, doctor, to just use the middle one for most of the cases, and maybe for a heavier set patient?
No, with male patients, I always recommend this one with males, adult males. This one for adult females, okay? But if she's an adult female who a little bit tall, so you could just go with this one. Basically, in Egypt, all users use this one for all adults, and this one for childs.
Okay.
Yeah, so this one for children and this one for adults. This is how users do it in Egypt, but you don't have to stick to this. So basically, this one is for females, this one is for adult males, and this one is for children.
Okay. The sizes determine the radiation dose, is that right?
Yes.
The default radiation.
Yes. And it's not just about the radiation dose. It's about, like I told you, the software algorithm plays a huge role within the image construction and the image quality. So I'm trying to give the software as much data possible, as much suitable data possible for it to do the image reconstruction and the image rendering as best as possible.
Okay. And doctor, for the cephalometric arm, we noticed what do you call the one that attaches to the ear of the patient?
Yes.
Yeah.
Yes.
We're not able to turn it around. How do we capture a frontal image?
I can shoot you a video how to turn it around. How can you please, or you can also shoot me a video. How can you not turn it around? I have a demo device in my office. I can shoot you a video on how to turn it around. It's very easy. Just turn it around with your hand.
So you can it can be rotated?
Yeah, with your hand. Just rotate it with your hand. So
maybe we just
it's very easy.
screw it.
Yeah, it's very easy.
Okay.
Yeah, we could later on. I'll be at the office at about 1 p.m. I could shoot you a video. It's very easy. It's nothing.
Okay. And carpus, that is for the hand?
Yeah, for the hand. We have like a very big thing to put your hand, the hand on, and take the hand scan for.
Okay. I got it.
Yeah. I can also show it to you. I can take photos for it.
Okay. Thank you.
Yeah, you're welcome. So now regarding the cases, so I can view our CT scan. I'm just choosing a case. Okay. Which one? Let's view this one. So just by double clicking on this on whatever case, it will open the 3D software. So this is our full 3D software. First of all, you guys can see how quick the software and easy to use. So anyone with previous experience with the 3D softwares, you will know how laggy it is, the 3D softwares in general. So this one is not laggy at all. It's easy to use. First mode, like I told you, is the MPR mode. The MPR mode mainly axial, coronal, and sagittal cuts, and an animatory reconstruction of the patient's mouth. A basic rule: in order to view anything on one of these views, you have to align the crosshair on the required area on the two other views. So, for example, I want to view the dental nerve within the sagittal view, then I'll have to align the crosshair approximately on the area where the nerve is on the other two views, and move it to view as much teeth as possible. Like you said, like I aligned my crosshair here, you could see in the sagittal section how the dental nerve is completely clear. So this is one of the ways that we could actually draw the neural canal, in which we align on the crosshair on the axial and the coronal area to view the nerve through the sagittal view, and start by drawing the nerve. I just clicked on canal here, mandibular canal here, and I started by tracing the nerve of the patient. So this is one of the ways to draw the nerve. So as you guys can see here, while moving through the axial cut, I'm just moving with the nerve. Also with the sagittal, I did accurately trace the nerve in just very few seconds. So it's very easy to do it. It's one of the ways. We have multiple other ways. Oh, go ahead.
How are you moving it incrementally? The green
So I'm
line.
just using my scroller.
Yeah.
Yeah. So it's always, whenever you're using a 3D software or a designing software or a scanning software, it's better to always use a mouse.
Okay.
Not just stick to the pad of the laptop there. It's not that good.
Okay. Got it.
So this is like I told you, the basic viewing mode. The second viewing mode is the pano, where the software automatically creates a panoramic image. So the thing is, having a panoramic image does have multiple advantages. First of all, for new users of CBCT, it's not really easy for new users or young clinicians to obtain the diagnostic informations and know how to align the crosshair on the axial and the sagittal and the coronal views. It's easier for them with the panoramic image. So you could just move the crosshair through the panoramic image to the desired area or the area you want to see, and automatically on the axial, the coronal below, the axial and the coronal and the sagittal views, it does change and it does move with you. So I'd like to, for example, diagnose this lower 6 on an axial way. So I just move this crosshair and I'm just viewing it axially and coronally and sagittally in the same time without actually going to the MPR mode. So this one is easier for new people who just started using CBCT and want to obtain as much diagnostic information as possible. So I could also draw the neural canal from the panoramic image, but it would not be too accurate because I'm drawing it through a 2D image. So whenever I'm going to draw the neural canal from the panoramic image, I always recommend to put the thickness on 15 and then start by drawing the canal.
Doctor, what is this a thickness of?
Okay, so basically I'll tell you. The thing is, The image is divided into slices, right? You have multiple slices. So 15 is a slice which is in the middle of the scan. So I'll be able to detect with my eyes the anatomical structure of the nerve better on a slice that is in the middle, rather than the full thickness slice of the patient.
Okay, I understand.
So that's why whenever you're drawing the neural canal on a 2D image, just put the thickness on 15. But for better image quality, of course, put it on the full thickness. But in
Okay.
general, I do not recommend drawing the neural canal or the mandibular canal from the panoramic image, because this is not a 3D image, it's just a 2D. And as you guys can see here, there's a difference. See how a little bit zigzaggy the nerve is, and here it's 100% straight. Nerve is never straight in real life. It's never 100% straight in real life. But this is because I drew it on a 2D image.
Okay, I got it.
Yeah. So the third mode is the implant mode. In the implant mode, we can do actually multiple things through the implant mode. First of all, we could do the most accurate way to trace the nerve. So this one was accurate, the one we did on the MPR mode, but this one would be more accurate also. I'll just go to the desired area, or the area I know the nerve mostly is at, and I'll just click on canal, and here I can detect the exit of actually the nerve, and I'll start drawing it and tracing it from this area. It will take a little bit more time, but it will be more accurate. So when you're actually planning an implant that you think it would be a little bit close to the nerve, it's better to draw the canal in this way. So you guys can see how zigzaggy, because we're not just drawing the canal, we're actually drawing the nerve inside the canal. We're tracing the nerve that is inside the canal. So this is the real nerve of the patient. So you could see the huge difference between this one and this one. So this is how accurate this one is. Mostly, most softwares just gives you the ability to do this one.
Doctor, you click the pen, right? The pen tool, and then
Yeah, I'll tell you how to do it again. Just give you a quick. I'll just move the crosshair here to the desired area, which I know by my information, I know mostly that the nerve exits or enters the canal from this area. So I can here see that this is the entrance of the nerve. Okay, so I click on canal here in the upper. Okay, I click on canal here and start by tracing it by putting point after point.
Okay. And then you're using the mouse scroller.
Yes, I'm using the mouse scroller to scroll through the image.
Okay. Doctor, why are there many different split images down there?
Yes, this is always available with the implant mode. It's just to give you within the ROI you are putting the crosshair at, to give you multiple thickness and multiple viewing modes and multiple cuts in order to accurately view your implant that is placed. So, for example, I'll just show you now how to virtually place an implant, and you'll get the idea. So, for example, let's say that our treatment plan is actually to remove this lower 6 and place an implant. So I'll virtually place our implant first. Let's go by Stroman. New dent, TSLA. Okay, let's go something. Okay. So basically, this is our implant library. Okay.
Yes.
So to access our implant library, you just click on implant here, and it will open the whole implant library. You could use multiple brands. We have multiple brands here.
Doctor,
Okay. And of course, go
if
ahead.
there's a brand that's not available in the database there, can it be
We have
added?
two options. You have two options. Either you could put the height and the diameter of the required implant, and you actually create it, or you could just tell us the brand that most people use in the Philippines, and you would like us to add it within the next software update.
Okay. I see. So
Yeah. So it's very easy. Yeah.
okay. And so if it's not yet available for this software version, you can manually input the data of
Yes,
the
the data.
Okay.
Yeah, exactly. Make
Can
sure
you
to always choose the area where the implant will be placed.
okay.
Then, like you see here, the implant is already placed.
Okay.
Okay. So
All right.
now I'll show you something. Just view the below sections. You can see here multiple cuts through this coronal view. We have multiple cuts, and actually, in order to verify the implant placement and to perfectly align our implant, we use the verification mode. See here, we have multiple buccolingual and mesiodistal sections of the implant in order to accurately align it within all views at one time.
Hmm.
So
Okay.
actually, for all implantologists, this viewing option is very useful for most implantologists who actually do virtual planning before their cases.
Hmm.
So basically, this is the sole purpose of the verification mode. So we don't use this verification mode with anything unless it's an implant.
So verify is for you
Yes,
to
is
be
the
able to be
verification.
sure
Yeah,
to be sure that the position is correct.
exactly. Exactly. Followed on by the TMJ mode, like I told you, we have for TMJ diagnosis, like you asked me, people are concerned with it. So you could actually emphasize on the point that we have a whole viewing mode for the TMJ. This is the whole viewing mode for the TMJ, in which you could just move the crosshair to view the TMJ, or you would like to view the sinuses. So I'm just moving here to view, as you can see here, the sinuses are clear for me. And if I'm taking this with this scan with a TMJ chin rest, then even I will have more data to obtain. But with the standard FOV, like you see, I can check the whole mandible, mostly the whole mandible. I can check it. But of course, you can never limit you can never limit the doctor's uh, the structures that the doctor would like to obtain to do the full diagnosis. So we give him the option to take just a scan that is with the sole purpose of viewing the TMJ. So then you would choose through, if it's a panoramic image, then you would just choose from the acquisition mode here, TMJ, place the TMJ chin rest and take the image. If it's a CT scanning mode, then you would just choose the normal mode, then the FOV of 16 by 10, and the large patient, and use the chin rest, the CT chin rest, and view it through the TMJ mode. So basically, that's all. Basically, that's the most important things. The most of the other things that are available, which are things that are available with most CTs, which is for example, of course, you have a ruler in which you could measure the distance between two anatomical structures within your scan. So, for example, you'd like to measure the distance from the tip of the root of this lower premolar to our nerve. So for example, just by clicking like this, and it's giving me 7.60 millimeters. From here, this is our object list. Always you could edit anything that you have adjusted or added to the image from here. So for example, if I would like to just remove this ruler thing that I just added, I just click here on delete. So just show you this one also, this thing. So this one, okay, by choosing an area using the region of interest eval, this icon, by choosing this icon, I could choose any area within of my CT scan, and the software will automatically calculate the bone density within this area. So this also very beneficial with implantologists, because we go to the ROI area and just highlight it, and the software will calculate the bone quality and the bone density within this area, whether it's D1, D2, D3, or D4. So basically, the whole red area is D4. The very limited blue area is D3, and the green area is D2, and the yellow area is D1. And but as you guys can see, there's no yellow area here.
Okay.
So the percent of the D4 is 98.47. So basically, and to be 100% also honest with the grayscale analysis, it's not 100% accurate in all softwares. So it's not 100% that the level of bone here is D4. But what is 100% accurate, that there are different densities in these areas. So this area is less dense than this area, is less dense than this area. But
Okay.
you cannot actually detect that it is 100% D4 or D3 or D2, because
Okay.
when whatever scans we take, the with whatever software, even if a software that will be created in a billion years, after a billion years, it will not also be able to detect 100% the bone quality, but it will detect the density, and it will tell you that this area is much more denser than this area, or this area is less dense than this area.
Okay.
So it's a guide. It's not
Yeah.
100%, but it's a guide for the practitioner.
Yes. Can give you a comparison maybe
Yes.
in the density.
Yes, of course. Yes, that's the thing. So basically,
Doctor, what is the dissect button?
okay, I'll show you. So it gives you it's basically, it gives you a dissection of the it's like a grayscale ruler. So basically, it gives you, when you dissect the area here, I'll just show it to you, for example, at this lower 6. So it does like a grayscale analysis of the intervals between the cuts. So basically, it's just a calculatory thing for for the people who would like to do grayscale analysis for the cuts and the bone at the same time. So you combine this one with the ROI eval.
Okay.
So yeah, not mostly used.
Not very used. Okay.
Yeah, not used too much.
How about draw DA?
So it manually, okay, so regarding the panel here, this is the panel, okay? So in order
Yes.
to obtain a panoramic image, you have an automatic drawing of the dental arch. Okay, it does an automatic drawing, and honestly, the software does it perfectly. So if you would like to draw it manually, then you just tell it that you will delete the dental arch and you will start by drawing it manually. So
okay.
So,
I understand.
So basically, you will not need to do such a thing.
You draw the arch to reconstruct.
Yeah, you draw the arch in order to reconstruct the 2D image. If you'd like to, you could go ahead and do it. If you do not like, you don't have to.
Okay.
So,
and how about 3D VOI?
Okay, I'll show it to you now. Just a second. So the 3D VOI is the animatory, the animatory thing that's automatically designed for the patient, complete animation that you could actually view. So also.
Okay. But this view can also be in the MPR, right, doctor?
Yeah, you could view it from the MPR, yes.
Okay.
Yes. Here. It's the same.
Okay.
Yeah, just the same.
Okay.
So basically that's all. That's all regarding the software. What I'd like to emphasize on that we will always have updates, we will always have improvements. So right now, while scanning, you have the HD mode. The HD mode actually takes a little bit more time within the image reconstruction, but the image quality is exceptional, especially regarding root canal. Because when it comes to root canal, we need to see very, very fine details of the canals.
Yes.
So we have the HD mode now to actually have a better image quality. It takes the same time of scanning, which is 18 seconds, but it takes much more reconstruction time. So whenever you're taking for a root canal, now in the softwares that are available, we have the HD mode in which the quality of the scan would be better. That's mainly all. Yeah, go ahead.
Mode, should it be shot in 4x4, doctor, or?
No. You could shoot it in 16x10, 8x8, or 4x4, whatever you want.
And then you could still see the details for the root canal.
Yes, it just enhances the image quality.
Okay.
Yeah. Through also the same device, but with just a different software updates, So the software plays a very huge role.
Yes.
So having a complete R&D team that has the sole purpose of creating a good software and keep on improving it is actually our huge selling point as eTeeth. Because most other Chinese companies, they just buy the device, they do not manufacture it, or they don't do the software, and they just buy it and put a logo and sell it. So you don't have regular maintenance or regular software updates or regular improvements.
Right. Doctor, how do you create a report for printing to the patient, for example? It's a image or
okay. So you have multiple ways to do a report. First of all, I'll show you something here. You could have this view, for example, an axial view here, and you could just take a screenshot here. So I'm taking a screenshot just to create a report through this axial views, or I could do the same view by changing the grid. I'm changing the grid, I'm changing the viewing options. So here, basically all reports, you have to obtain this data.
Okay.
This is the data that is required within the report.
I
So
see.
always always go to the region of interest and just do the split view thing into the maximum and take a screenshot.
Okay.
Then as a radiology center or dental practice, I should always have a document that is ready to accept such a screenshot. A Word document or a PDF document a template that is always ready to accept such a shot and just fill in the information of the patient and fill in the diagnostic information that I have obtained as a doctor through this shot.
Okay, understood.
Yeah. So basically that's all. If you guys need anything at any time, I'd be more than happy to receive your questions. This is how you could actually reach me through my email or my Instagram account or through anyone through A-Teeth. I would be more than happy to assist you whenever you guys want.
Thanks so much, doctor.
Thank you so much, and I hope you have a nice day.
Yes, likewise.
Thank you.
Thank you. Thank you so much.
Thank you. Thank you.
Yeah, it's really nice course. Thank you, Dr. Mana.
Thank you. Thank you so much. Thank you.
Yeah, nice to meet you, doctor.
Maybe in June, I still have some lecture course. Need to invite you to introduce the Helios 500 or Helios 680 to our customer in Europe.
Yeah, it would be my pleasure.
Yeah, thank you.
It would be my pleasure. Yeah, it would be my absolute pleasure.
Okay. Thank you for your time.
Thank you so much. Thank you.
Bye.
Have a nice day.
Yeah,
Bye.
have a nice
Thank
day.
you, doctor. Thanks, Ryan. Okay.
Yeah,
Thank you.
Bye.
Goodbye.
Thank you.
bye.